Most common types of altered cell growth, such as moles or skin tags, are benign and do not require intervention. Malignant cell growth or cancer, however, is serious and without intervention leads to death. Some facts about cancer is that it will occur in 1 out of 3 people living in North America. 1.5 million are diagnosed each year. 10 million Americans are living with cancer and 5 million of those are considered cured. 80% of cancers are caused by chemicals such as tobacco and alcohol. Tobacco is the single most important source of preventable carcinogenesis. You want to see Table 23-7 for types of cancers that are associated with tobacco use. Then there's physical carcinogens such as radiation. There's viruses such as oncoviruses. And then of course the immune function. Age is the single most important risk factor for cancer. Then we have the genetic risk. There is a positive test result for a gene mutation shows that a patient is at greatly increased risk for cancer development, but the cancer may still never develop. Okay, so let's discuss a few terminology. We have hypertrophy, which is a growth that causes tissue to increase in size by enlarging each cell. We have hyperplasia, which is growth that causes tissue to increase in size by increasing the number of cells. We have neoplasia, and that is any new or continued cell growth not needed for normal development or replacement of dead and damaged tissues. Okay, so let's discuss normal cells. We have apoptosis, which is a cell that is programmed to automatically die. Then we have limited cell division for replacement. We have specific morphology. They are small nuclear to cytoplasmic ratios. They have a differentiated function. They have tight adherence. They are non-migratory, orderly, and well-regulated growth, and they have normal chromosomes. Early embryonic cells have a rapid and continuous cell division. They run into anaplasia. There ends up being a large nuclear to cytoplasmic ratio. The specific functions are lost. They lose adherence. They start migrating, and they have no contact inhibition. The benign tumor cells are continuous or inappropriate cell growth. They have a specific morphology. They are specific differentiated functions. They have a tight adherence. There is no migration. There is an orderly growth, and they have normal chromosomes. Cancer cells are rapid or continuous cell division. They have anaplasia with loose specific appearance, a large nuclear cytoplasmic ratio. Specific functions are lost. They lose adherence. They migrate. Their contact inhibition doesn't occur, and they have abnormal chromosomes. They're either lost, gained, or broken. Okay, so let's get into the phases of cancer development. Let's talk about initiation. Irreversible event. If cell division is left unchecked, cancer can develop from even a single cell. Carcinogens are chemicals, physical agents, or viruses that change the activity of cell genes. Promoters are substances that promote or enhance growth of initiated cancer cell. Okay, let's talk about progression. It's the continued change of a cancer, making it more malignant over time. It develops its own blood supply. It does this by tumor angiogenesis factor. Selection advantages takes place. Carcinogenesis and oncogenesis are names for cancer development. Malignant transformation occurs through these steps: initiation, promotion, progression, and metastasis. Metastasis occurs when cancer cells move from primary location by breaking off from the original group and establishing remote colonies. Even though the tumor is now in another organ, it is still a cancer from the original altered tissue. Blood-borne mets, these are tumor cells released into the blood, is the most common cause of cancer spread. These clumps of cells get trapped in distant capillary beds. The lymph system is an additional way for tumors to spread. So let's discuss metastasis. Metastasis occurs through a progression of steps: extension into surrounding tissue, blood vessel penetration, release of the tumor cells, invasion, local seeding, and then bloodborne and lymphatic spread. Tumors are classified through tumor classification. This is done by type of tissue from which they arise. Additionally, biologic behavior, anatomic site, and degree of differentiation. There are two major categories: solid from a tissue and hematologic from blood. Tumors are graded and staged. Grading classifies cellular aspects of the cancer. It compares with the parent cells, and it helps determine prognosis and therapy. Ploidy classifies tumor chromosomes as normal or abnormal. If abnormal, aneuploidy increases with the degree of malignancy. For example, would be Philadelphia chromosome. The staging classifies clinical aspect of the cancer, such as location of the cancer and its degree of metastasis. This is done by TNM, tumor node metastasis. Okay, so we're going to discuss grading. GX is of grade that cannot be determined. G1 is that tumor cells are well differentiated and closely resemble the normal cells from which they arose. G2, the tumor cells are moderately differentiated. They still retain some of the characteristics of normal cells, but also have more malignant characteristics than the G1 tumor cells do. G3 tumor cells are poorly differentiated, but the tissue of the origin can usually be established. G4, the tumor cells are poorly differentiated and retain no normal cell characteristics. Okay, in staging we will discuss primary tumor, regional lymph nodes, and distant metastasis. The initial T stands for primary tumor. There is TX, the primary tumor cannot be assessed, TO, which is no evidence of a primary tumor, TIS is the carcinoma in situ, and then T1, T2, T3, and T4 is increasing size and or local extent of the primary tumor. N, which stands for regional lymph nodes, we have NX, regional lymph nodes cannot be assessed. NO, there is no regional lymph node metastasis. And then we have N1, N2, and N3, which is increasing involvement of the regional lymph nodes. Then we have M, which stands for distant metastasis. MX is presence of distant metastasis cannot be assessed. And then MO, there is no distant metastasis. And M1 is distant metastasis. This concludes Cancer Development Lesson. If you have any questions related to the content of this lesson, contact the instructor.